Let's decode cancer in India in under 6 minutes. Patterns, programs, and what you must say in exams and clinics. Cancer is a growing public health problem. You'll meet it in screening camps, NCD clinics, and hospital postings. Clear basics help you counsel, triage, and refer without delay. India reports a large and rising cancer load. Think of it as a double challenge: high numbers and late presentation. Patterns differ by sex and region. In men, oral cavity and lung are consistently among the top sites, followed by esophagus and stomach colorectum depending on the registry. In women, breast leads, with cervix still prominent in many states, followed by ovary and colorectum. Urban areas show more breast and colorectal cancers. Several Northeast registries show the highest overall rates. Tobacco, both smoked and smokeless, remains the single largest preventable cause, especially for head and neck, lung, and esophagus. Alcohol acts synergistically with tobacco. Diet low in fruits and vegetables, obesity and inactivity push up breast and colorectal risks. Chronic infections matter. HPV for cervix, hepatitis B a C for liver. Add occupational exposures, indoor biomass smoke, and urban air pollution. Primary prevention: tobacco control, alcohol moderation, healthy diet and weight, physical activity, vaccination for HPV and HBV, and workplace environmental protection. Secondary prevention: under NPCDCS, adults 30 years and older are screened at primary care for oral cancer, breast cancer, and cervical cancer. Tertiary prevention: early diagnosis and timely referral, multimodality treatment, rehabilitation, and palliative care, including pain relief and end-of-life support. Non-healing oral ulcers or patches, persistent hoarseness, difficulty swallowing, abnormal bleeding, breast lump or nipple changes, postmenopausal or intermenstrual bleeding, unexplained weight loss, and long-standing cough. One persistent symptom is enough to justify evaluation. Front door is the Health and Wellness Center or PHC. Positive screen CHC District Hospital for confirmation. From there, referral to a cancer center within the National Cancer Grid Network or state cancer institutes. Teleconsultation and tumor boards increasingly guide standardized care. Remember the financial protection angle. Ayushman Bharat packages where eligible. Population-based cancer registries and hospital-based cancer registries, coordinated nationally, generate incidence and survival data. They explain why site patterns differ by state and help plan services. Quote PBCR, HBCR, and VIVA when asked, "Where do we get our numbers from?" Cervical cancer is largely preventable and detectable early. VIVA at primary care with a screen and treat approach reduces delays. HPV vaccination for girls is a public health priority. Even as rollout varies by state, you should counsel families about safety, schedule, and benefits. For oral cancer, tobacco and areca cessation, oral self-inspection, and regular visual exams for high-risk groups are practical and effective. For breast, teach breast self-awareness, perform systematic CBE, and navigate women promptly for imaging biopsy when indicated. Palliative care. Don't skip this. Pain relief, symptom control, psychosocial support, and home-based care must start early, not just at the end. Primary care teams can titrate analgesics using whose ladder, address constipation, nutrition, and caregiver fatigue, and coordinate with district palliative services. India's cancer profile shows oral and lung leading in men, breast and cervix leading in women, with marked state-wise variation. Major risk factors: tobacco, alcohol, infections, diet, obesity, inactivity, occupational and environmental exposures. NPCDCS enables population-based screening at 30 years and older for oral, breast, and cervical cancers at HWC's PHCs with defined referral pathways. HPV vaccination plus screening is central to cervical cancer control. Emphasize early warning signs, timely referral, and a role of PBCR, HBCR in planning. Integrate palliative care early. Address pain and support needs alongside curative intent. Rising burden, different top sites by sex, and strong prevention opportunities. Act on tobacco, infections, lifestyle, and environment. Screen systematically at the primary care level for oral, breast, and cervix from age 30. Refer fast, follow program pathways, and never forget palliative care. From community camp to cancer center, your clarity shortens the patient's journey. Teach one habit, detect one lesion earlier. That's public health saving lives. If you found this episode helpful, don't forget to like, share, and subscribe to the channel for more high-yield med school content.